Dr. Vidal, and we are here for plastic surgery, and I have a very, very special guest of honor today. I'm here with Sarah.
Hello. Hello, everybody.
And we are going to continue our lives regarding provider as a patient. So if you missed last week, I talked a little bit about my experience after plastic surgery and how the things that I learned that changed the way I explain to patients, I connect to patients, and I understand a little bit better about the surgery and the recovery. And now we're going to talk with Sarah because she has been through it too with a different procedure. So Sarah has been up here for almost 4 years. So she is our clinic manager, which means she is involved in the pre-op process, doing clearances, getting you ready for surgery, and then post-op, she's the one that you're going to talk to a lot during your recovery, questions, follow-ups through Claire, our messaging system. So she is, if there's someone that knows about the recovery and what to expect, it's Sarah. Yes. Even more than us surgeons, because she talks every day with multiple patients that are recovering during different stages. So like, if there's something out there, she's seen it, she's probably, like, she has talked to patients, see it, saw it in pictures and everything. So she has had 2 procedures, so we're going to start with breast augmentation. Yes. Tell us a little bit about your experience with that one.
Yes, so I have a breast augmentation for 3 years now. I have silicone implants. I have a type of implant called cohesive implants. And I remember this like it was yesterday. I was doing the consultation with Dr. Earl, and I was like, nothing larger than 310. Nothing larger than 310, and I have 405 cc's.
So we always joke about this because we as providers, we've seen the measurements and implant picking, and we tell all of our patients, no, you have to wait, it's depending on your body, like don't focus in a cup size, don't focus on cc's, because the same cc is going to look very different. And even though like it happens to be the same, she was doing my pre-op consult with Dr. Earl, and she started laughing because I did the same thing. It's like, I want a 275, and Earl looks at me like, that doesn't go with your goal and your measurements.
It's too narrow, it's going to look too small.
Yeah. So yes, I mean, I think it's something we all experience, that we have. It's a faith thing that you have to have with your surgeon. Like you have to give that away. Like you, of course, you're gonna do research. Of course, you're gonna see pictures and see what is the look that you like. But at the end, with that in mind and your measurements, your surgeon is gonna guide you.
Like, it's really what fits your body is what's gonna be best for you. You can come to us and have a certain cup size or a range of cup sizes that you're going for, but it's really what fits your body well, and we're enhancing what you're naturally coming to us with. And that's something that we both had to kind of overcome.
Yes.
And now, I mean, everyone will say that I didn't even know you had implants because it fits my body so well, and I wouldn't regret it any other way, going with the doctor's recommendation for sure.
Yes. So the other thing that we talk a lot about is about the gel type. So we use here Natrel implants, and Natrel gel implant comes in 3 types of cohesivity of the gel. What does that mean? The thickness of the gel, the feel. So the majority of the implants that we put in are the responsive kind. The responsive is a softer gel, feels more natural. Sarah has a cohesive gel, which is the thickest or keeps its shape more. And then there's the in between these 2, which is the soft touch. Okay, tell us a little bit about your experience with the gel.
Yeah, so like you said, I have the cohesive, so I have, to like keep it in a simple term, most cohesive, I would like to say it's the most dense feeling. It feels a little more firm. It does give a really nice shape against my chest wall, so it gives that upper pull fullness. I was going for an upper pull fullness look. I wanted to look like fairly athletic, lifted. I never had that. I was a small B cup, very deflated. It just thanks to my mother's genetics passing along to me, but that's something I always wanted. So I went with cohesive, and I absolutely love the shape. I love the volume. I don't love the feel. I personally think now that I've had them for a few years now, they're a little too firm for me. I like to do a lot of yoga and athletic exercises and laying on my stomach for those, and for massages. It's a little too firm for my liking. So that's something I didn't consider, but it's okay because I do overall like the shape and I like the fullness. So that is a very important key to think about when you're picking your implants.
Yeah, so it's something that we had talked a lot about, and it like touched them and everything, but now that she has it in her body, she can explain this to patients at a different level, right? Like it's completely different, and something that you wouldn't even thought about just by touching the implants. Like you think about the shape, but also it's to think about how they're gonna feel in your body.
Yeah, it really didn't cross my mind, and I think the cohesive is a great implant for somebody who's looking for a very augmented, full, fake look, which is perfectly fine. If that's what you're looking for and that's the augmentation you're coming for, the cohesive implant is something that you should consider for sure.
Yeah, because if you see the cohesive gel, all of these implants are full profile, which means like the rounder. This one is a little bit bigger, so you'll see that the responsive gel here, this is a 415, this two are 365. So if you see that this implant's a little bit bigger, it's because it is. It's not because of the gel, okay? So you see the cohesive, even when you're standing up, how the gel kind of covers the entire part of the implant. Then you have the responsive gel. If you stand up, the gel basically goes to the bottom to give you a more natural slope shape. And then you have the soft touch gel, which is like in between. It gives you a little bit of the natural and softer feel as a breast tissue, but it still holds the shape more than the responsive. Okay. So things to consider and things we learned with our surgeries. And let's jump to the other procedure, which was a BBL. Tell me about that recovery.
Total 180 to a breast augmentation. Still would not regret it at all. So I had a lipo 360 and fat grafting to the buttocks and hips. I didn't prepare mentally for this one because I work here. I see patients go through this every day. I had done the breast augmentation, so I was like, I got this. I think I'll be fine.
Yeah.
And I really cannot imagine being like harder on myself. Like I was trying to remind myself, like I'm strong. I can do this. I got this. I did this for a reason. Ladies and gentlemen, treat yourselves with kindness when you go through the surgery. It is very hard on yourself, so just be kind mentally. I think that's something I learned as a patient, is really talk kindly to yourself, motivate yourself from within, because it's a very hard recovery, but it is 100% worth it.
Yeah,
it's 100%
so the emotional roller coaster that we discussed, and I talked a little bit about this last week through my experience that I went through it. Like I tell the patients, you're gonna go through this, but it's not until you are going through it. And I was crying one day, like why did I did this to myself? And you have to kind of like take a step back, realize and like think about why you did it, rely on your friends, family that are helping you, and understand that this is temporary, that you will feel better and you will get to the body of your dreams, right? Why you did it, and it's a process, right?
Remember why you did it, and this is even like it's a 6 week, I would say, majority of the recovery. The first 6 weeks is the most mentally challenging because you're sleeping on your stomach, you're not sitting down, you're standing to eat. But again, going through why did I inquire with Pure? Why did I want to do this in the first place? It's that overall goal and that dream shape that you're hoping for.
Try to keep that in mind during that process. What do you think was the hardest part for you?
I think the massages, like reminding myself how important they were, because I guess you can't quite explain how they feel because each person experiences it a little differently. There's some patients with Jessica, our massage therapist, they're falling asleep in their massages, and I'm like, how is that possible?
Willie saying that he did it.
I don't know how you do that.
And spoiler alert, Willie's gonna be in one of these lives with you. He'll share his experience.
So I think that the hardest part was to get through the massages but 100% worth it. I think until I did maybe 24, 25. And it's just, pushing through and getting there, because it really does help your swelling, it helps prevent lumpiness.
Yeah.
So that was, I think,
important.
very important, and
Yeah.
I'm just like, okay, keep doing this. If they do get better, I would say after the first 2 weeks, it feels a lot better.
A lot better.
Yeah.
How was returning to work?
Yeah.
This is a question I get a lot from my patients.
Yeah.
Like, how am I going to go back to work? How am I going to drive? How am I, going to do my day to day?
When do you go back to work?
Yes.
So I'm a workaholic, and that's never gonna change. So I came
We
back.
all live in the healthcare industry where like that.
I can't be at home.
Yeah.
I'm at home sick and I'm still working. So I came back. I would say earlier than I recommend for patients. If you can take 2 weeks off, I'd take 2-3 weeks off.
Yeah.
I came back. At the time where I was living, I had about a 40-minute commute to and from work. So the BBL pill was a little rough for the 40 minutes. When I got here, I had like numbness in my legs a little, and I had to like kind of walk it around, shake it off. So if that experience happens for you, it happens a lot with the same position with the BBL pillow.
Yeah.
But it helped me get back to work and just keep my mind busy. So if you're at home recovering and you don't go back to work, that's perfectly fine. But try to find things to do to get your mind off of your recovery, and try to just pass the day so that it isn't so heavy.
Stressing.
Stressing
on you. Yeah. Okay. Awesome. Let's get to some questions.
Okay, well, I need to put down this phone
Okay.
from Pure Plastic Surgery. We're going live here too, so if you want to say hi.
Hello.
And now say bye.
Bye.
Okay, let's go to the questions.
Okay.
Okay. Okay, here we are.
Let's see.
Okay, can you have a lipo 360 at the same time for breast implant surgery?
It is possible, but it depends on your BMI. So you have to have a BMI that is less than 24 to qualify for that surgery, which is called a Miami makeover, which is the one that I did. And the reason for it is here in the state of Florida, we operate an office-based facility, and we have a limit of 1 liter of removal of fat, which if you're in a lower BMI range, then that's okay, because that's going to be enough to give you a good shape with like a 360. But if your BMI is higher, then it's not going to be enough, so it's better to stage it.
Okay. Hola, doctora Vidal. ¿Usted recomienda el IV postquirúrgico para el dolor? So translate for Sarita, please.
Yes. Yeah, so she's asking about IV pain medications. What do you think about that? So post-op.
So in the initial recovery period, when we're in our recovery room, we do have medications to get through the IV.
Yeah.
But keep in mind a realistic pain goal. So you won't have no pain, of course. You won't have a pain of a 2 or a 3. Our goal in PACU is overall your ABCs, your airway, your breathing, your respirations, making sure your circulation system is recovering well. So we don't want to give too much pain medicine that's going to harm you overall. So a goal of, I would say maybe like a 5 to a 7 is more realistic for IV pain medicine.
Yeah. Yeah, and then you go home with PO medications, right? So really, I didn't have BBL, but I had lipo. And I think for me, the pain was that I needed stronger pain medications was 24 to 48 hours, really. The rest, I was okay with just Tylenol. Because, I mean, you are going to feel sore. The pain is more like a very, very bad going to the gym, everything's sore. But it's really when you're changing positions, like getting up from bed, moving, sitting down. If you're resting, the pain tends to kind of settle in. Yeah, and sometimes.
With the movements, yeah.
With the movements, yeah. But then after the first week, then I was okay. Yeah.
Yeah, for me too. I think I did the narcotic for 3 days. Ibuprofen was helpful for me. I like ibuprofen a lot. So instead of Tylenol, it helps more with inflammation. So that is an option after 48 hours post-op as well for you.
Yeah, ibuprofen is great. I'm allergic allergic, so unfortunately I couldn't take it, but I do recommend it to all my patients after 48 hours because I think it does target more pain, muscular pain, inflammation pain, better than just Tylenol. Para contestar en español, yeah, we turned it into English, yeah.
Sorry.
Para contestar en español, disculpa, la voy a contestar. Los medicamentos intravenosos te los puedo contar en la área de recuperación aquí antes de mandarte para tu casa. Pero luego vas a tener medicamentos por boca. En Latinoamérica hay algo que se llama la bombita del dolor, que es un medicamento que uno se lleva para la casa y te administra con botón. Eso lamentablemente no lo tenemos aquí en Estados Unidos, no está aprobado por la FDA, así que yo no te puedo mandar con eso para la casa. Lo otro que yo pienso en realidad es que el dolor va a estar controlado por los medicamentos por boca y yo no quiero que también estés tan dormida que no puedas caminar, yo quiero que estés moviéndote, que estés caminando. Los medicamentos por vena, los intravenosos para el dolor te van a poner demasiado somnolienta y eso no es bueno para tu recuperación, para evitar coágulos. Así que por vena mientras estés aquí, ya cuando el dolor esté controlado, te vas para la casa con pastillas.
Gracias por tu español.
De nada.
Okay, implant exchange from 280 to 385. It's a big difference.
So, rule of thumb is that 100 cc's is roughly 1 cup size. Of course, everybody's laughing at my answer. No.
A message from
Oh,
Dr.
a
Earl.
message, okay.
From Dr. Earl.
Oh,
Oh,
okay.
boss.
Okay.
He's
We're
watching.
behaving. We're doing everything right. We're not, yeah, okay. Let me finish the answer. So 100 cc's roughly is the cup size. Of course, for everything, every cup size or every bra brand looks very different. And especially if you take a cup size that fills it completely, doesn't fill completely. So I don't like to go with cup size like strictly. I like a range, but going 100 cc's, roughly you'll go at least a cup size from a C to a D, but roughly, okay?
Okay, are you ready for the message from
No.
Dr. Earl from the
We're ready,
GOAT?
we're ready. I'm scared now.
Bring it.
Okay.
Queremos que Sarita hable español.
Anda.
I understand more than you know.
Say something in Spanish.
No, I'm on the spot.
I believe it. No, nothing. Okay.
Okay, there's...
Hola, bye.
Hola.
I don't know anything.
Hola.
We're done. No más.
Se acabó. Ah, here you go, no más.
Okay, people's asking about consultations and prices for tummy tucks and mommy makeovers right now.
Yeah.
Yeah.
So there's a few different ways to do consultations. You have a consultation you can book with your surgery coordinator. It's at no cost. So you're going to give you a lot of information about the practice, the history of each surgeon, the experience they have. You can book a virtual consultation for each surgeon and also an in-person. We would love to see you in person. I think that's the most beneficial way to meet the surgeons and get to know you as well as a patient. So inquire through our website or through the link tree on all of our socials, and it's going to take you through the steps of inquiring.
Yeah, and one question that I get a lot is like, I go to a website, but I don't want a virtual consultation, I want to come in person. The easiest way is still click the virtual consultation form, because that is gonna kind of put you in the system. And I know it asks you for pictures. The pictures are very, very important to try to see if the surgery that you are requesting is ballpark something that it's a fit for you. Of course, when you come in person, we're gonna examine you and it may change, but it's a guide to get you and then booked and for the consultation. So even if you wanna come in person, the easiest way is through the virtual consultation form in the website.
Okay, this is the common question I ever get.
Yeah.
I don't know if I'm in need of a tummy tuck or I just can have a BBL.
Yes, very, very common question we get. And I like to explain it in a way that everybody understands that these two procedures really target different things, okay? So a BBL or liposuction just removes the fat below your skin, in between the skin and the muscle. That's called the subcutaneous fat, is the fat that you can pinch when you're pinching your abdomen. So the BBL is just gonna remove that or liposuction. It's not gonna take care of excess skin. It's not gonna take care of muscle laxity or weakness, okay? So when we have pregnancies, when we have massive gain weights and gain losses, the muscles in the abdominal wall distend and then they go back, but sometimes they don't go back to the midline, okay? They just flatten and you have a weakness or a diastasis, separation of the muscles in the center. That, unfortunately, cannot be fixed with working out, with losing weight. That separation is just like a stretching of the fascia or the tissue that's in between the muscles. The only way of putting that back together is by suturing it, which is done through a tummy tuck. That also brings the waist in. So I have a lot of patients with diastasis that decide to do liposuction BBL first and say, but I don't look at snatch, my waist is not brought in. It's because that muscle separation kind of widens the waist too. So you have to bring those muscles in and that acts like a corset. Yeah, and that brings everything in. So it targets different things, and also we can do fat transfer to the hips if you're looking for more of an hourglass with the tummy tuck. It is a possibility. So if you're still in the fence between the two, it's best so to send your pictures, get a consultation, an evaluation, and we can let you know if it's better to proceed with a tummy tuck first or to do the BBL.
Okay, and the last question, because we're on time, it's vacuum therapy. Is it safe for the BBL you performed 1 year and 6 months ago? So it's a patient of yours.
Vacuum?
Vacuum therapy.
Vacuum therapy. So I don't know if it's the same that you are referring to. Vacuum therapy can be to suction the skin. Some people do that after the BBL or even before to kind of expand the skin of the buttock. I haven't seen good results with that. I don't think it does much of a difference. If you're trying to treat a very localized flat area that it's not caused by a dimple of cellulite, it may be something to consider, but I don't think it's gonna expand the buttock skin as a BBL, which is transferring the fat and actually putting some volume in. So I would take it like a case by case, but I haven't seen very dramatic results with it. Some social media posts that you see dramatic results with it are very early on. So they do the suctioning and initially it's gonna be swollen. So that's what you see. But then give it a few weeks and most of the time, and most of the time the swelling goes down. And it's similar, I don't know if you guys saw a couple, I don't know, it was months or a year ago that people were doing it on TikTok and like putting a suctioning to cause expansion of the lips. This is all something temporary. Of course, the lips are gonna look plump for maybe your event, an hour or two, and then they're gonna go back to normal.
Okay, and last but not least,
Free
transfer to the hips.
Okay, so reminding everybody of the promotion that we're running. So for the month, if you're booking tummy tuck, mommy makeover for the month of February and March, we're giving you free transfer to the hips. Okay, so give us a call. Don't miss on it.
That's incredible. That's like
that's
killer. That's my favorite procedure.
Yes, that's like a must, right? Like the tummy tuck, the transfer to the hips.
Brings your waist in
and kind of completes that hourglass.
It's beautiful. Catch well here.
Yes. Okay, guys. Thank you so much. Thank you so much.
Of course.
I'll see you guys next Tuesday on Tuesday.